Hello and welcome, everyone. Thank you for making the time today to join us to learn about oral health. I am Denise O'Connell, the Associate Director for the Leonard Deneen Health Education Alliance of Maine. We are a program of Massachusetts General Hospital and the Slavin Academy for Applied Learning in Boston. With me today are my colleagues Tara Wilson, Samantha Knock, and Larini Nelligan. Since 2011, we've been providing education on critical public health problems where we know education gaps exist, and this has been at no cost to Maine participants. The organization was made possible through the vision and generosity of Massachusetts General Hospital and the Lunder family and the Lunder Family Foundation. And our charge has been to improve health by providing continuing education and support to healthcare professionals. The funders had strong ties to Maine, hence the Maine focus, and this has really been a unique initiative connecting a major academic medical center in one state with a neighboring nearby rural state. For the first 10 years, we primarily developed programs for healthcare professionals and learning for healthcare professionals because it's lifelong. But we also created complementary materials for patients and consumers. And most recently, we developed a totally consumer-focused program titled Motivate at Home, an component of that program titled Ask the Dental Expert. Next. The session is being recorded, so we will do our best to repeat questions when they're asked. It will last 30 minutes. We've turned off your videos because we are recording it also to be displayed on YouTube so that as many people as possible can learn as you are today. So please take a minute to read this disclosure. On the next slide. Next. And we also want to remind you that this is an educational program and not intended to render any medical advice or healthcare. Next. Let's begin. So as we present this information, if you have any comments or questions, feel free to use the chat feature and enter your question or use the raise your hand feature. Today is one in a series of presentations for the newest program, Motivate at Home. Motivate stands for Maine's oral team-based initiative, Vital Access to Education. This new program reaches a new audience of caregivers, care partners, and anyone who cares about older adults who are living at home. It teaches the importance of oral health and how all of us play an important role in promoting that good oral health. The program was funded by the CareQuest Institute for Oral Health and was modified from our existing program that provides education to nursing home teams. And it's recently been published in the Journal of Public Health Dentistry. The program is web-based, online, 24/7 access, but our pre-program needs assessment revealed that most learners also wanted some face-to-face time live with a dental expert. The next 2-minute video will explain the program as seen by a caregiver herself.
Hi, I'm Carol Higgins Taylor. I help and provide support for my mother, who's in her 90s, even though she still lives independently. It's called being a care partner. If you're a care partner like I am, you might be interested in participating in a new program, Motivate at Home, which is very helpful. I love that the program was developed by health experts and organizations right here in Maine, so they know Mainers. The program is designed to teach people how to provide oral care for a loved one. Even if you don't personally provide this direct care, you'll learn how to promote oral health care for your loved one and others who may be in their situation. Caregiving and care partnering can be difficult. Like me, if you have conflicting feelings about your loved one's oral health or lack thereof, what I've learned is that it's never too late to address oral health. It's better to start somewhere and do something than do nothing at all. This program helps get you started. The initial Motivate program was developed for health professionals who care for nursing home residents. The videos and posters from that program were modified for people like us who are care partners. They created a survey, held focus groups, and spoke to care partners across the state when developing the Motivated Home program. The best part is that the Motivated Home program is free. This website is very easy to use and has all the education someone needs to complete the program. There are no other books or materials required. The website has brief videos, posters, audio recordings, and other resources. The videos can be viewed at any time at your own pace, and the posters dispel common oral health myths. You'll learn tips for providing oral care for someone who has dementia or is otherwise resistant to care.
Great. And I'm Tara Wilson, and I'm thrilled to introduce our speakers for today's presentation, Drs. Leonard Brennan and Rodney Larson. Dr. Brennan is a faculty member at Harvard Dental School. He's a geriatric advisor and lead for Harvard's National Center for Equitable Care for Elders, for the Nurse Practitioner Dental Interprofessional Model, also for the Oral Health Workforce for Rural and Vulnerable Populations, and geriatric lead and instructor for predoctoral oral health education and training for Aging America. Dr. Brennan practiced general dentistry in Portland, Maine for almost 40 years. Dr. Larson earned his BS in pharmacy from Ferris State University and his PhD in social and behavioral pharmacy from the University of Minnesota. He spent several years as an assistant professor of administrative sciences at Idaho State University. In 2000, Dr. Larson returned to Ferris State University as the assistant dean of admissions and student academic affairs. 2007, he became the founding dean of the Husson College School of Pharmacy in Bangor, Maine. There, he led the program through full accreditation and 5 graduating classes before returning to Ferris State University of Pharmacy as its first assistant dean of academics and practice in 2018. Today, they'll provide an overview of medications' impact on oral health. After their presentation, we will wrap up the session by asking for your feedback by completing a brief survey, and I will enter a clickable link in the chat for you to complete the survey. So I will turn it over to Dr. Brennan and Dr. Larson.
Well, thank you, Tara and Denise. Welcome, everyone. We're here to talk a little bit about medications and oral health. I'll give a brief overview, then turn it over to Dr. Brennan to talk about a specific area that's a common problem with oral health. First of all, there are some treatments that you may think of when you think about oral health, and that includes obviously fluoride. Whether that's in toothpastes, in the drinking water, or prescription medications that supplement that fluoride for individuals who need it. Also, antibiotics are a common therapy for dental procedures, whether it's a result of a procedure or perhaps an abscess that occurs before or after a procedure. Those are common treatments. Remedies for dry mouth, which is the topic of the latter part of that presentation that Dr. Brennan will go into much more detail on. Certainly a problem that affects many areas of oral health. And then pain relievers, whether you're talking about regular Tylenol, aspirin, ibuprofen, anesthetics like Orajel, or even when you're talking about tooth extractions where you might get a Tylenol number 3 or an opioid of some sort for severe pain. So those are some of the common treatments that you see in the oral health care. But some of those treatments and then many other treatments have side effects that affect oral health care. Of course, as I mentioned, dry mouth is a common problem, and there's many medications that can cause dry mouth, including antidepressants, antipsychotics, antihistamines, some antihypertensive medications, diuretics, of course, decongestants are common medications that can result in dry mouth. Fungal infections are another issue, especially with antibiotics. Antibiotics will kill the bad bacteria, but also they'll kill the good bacteria too, and your mouth has both. And typically that good bacteria is wiped out along with the bad when you take antibiotics, and that can result in fungus taking over, oftentimes called thrush, and that's something that needs to be watched out for when taking antibiotics. Your mouth has a certain pH, acid level, acid-base level, and some medications can throw that off. A common one that many people take is Flonase. Although it's nasally administered, it can get into the mouth and cause that pH to be go out of balance, causing enamel destruction, or even result in again killing off some of those beneficial bacteria. Gingival overgrowth. That's something that certain medications, antihypertensive medications, calcium channel blockers, for instance, immunosuppressants, some anti-seizure medications can cause this condition. So if you're on one of those, that should be watched out for by your dentist or your healthcare provider. And then finally, ulcerations can occur. Some diabetic medications can cause this, some immunosuppressants, chemotherapy, radiation can cause these ulcerations. And again, that can cause pain and would require additional attention by a healthcare provider. Next slide. So what do? You may be on a number of medications. Some of them may or may not affect your healthcare. One of the things you can do is certainly ask the question of your prescriber, whether it's a physician, dentist, ask your pharmacist, can these medications affect your healthcare, your oral healthcare, especially if you're experiencing some kind of problem. And then ask them also what you can do to prevent, certain, the instances of those side effects that were mentioned in the last slide. Is there anything you can do to make sure those things don't happen? And then finally, when should you seek additional medical or dental care? For instance, I mentioned thrush, that fungal infection. If you are taking antibiotics and you notice white patches on the inside of your mouth and your cheeks, that certainly does, it's a good idea to go talk to your physician or your dentist to get treatment for that. So those are good questions to ask your provider, and it's important to keep your oral health in check. The next part of the presentation will be Dr. Brennan, and he will go more in depth about dry mouth, I mentioned before, and some possible treatments that you may want to consider.
Before I start, thanks, Rod. Before we start, can I go back to the previous slide just for a minute? Because that's really important, Rod. This slide is an incredibly important slide, because when we think of the mouth and we think of problems with the mouth, we think of the dentist. The treatment of the oral cavity of the mouth is really a team approach. So when you think of, if I have a problem in the mouth, who do I talk to? It is your pharmacist. It is your physician. It's your nurse practitioner. It is your social worker. We have limited the mouth to just the dentist, but we have to remember that most seniors do not have the finances to get into the dental office, over 70%. So that most of that oral health information may come from Dr. Larson, or may come from Denise O'Connell in her roles, or with your healthcare team. So that's why this is really, really important. So the information on prevention and treatment may not be a referral to your dentist, since so many cannot make that move because of either the finances or a number of other obstacles to care. So it's really important to put the team together, and when you think of the mouth, not to just think of the dental portion of the team. Next slide, please. One of the issues that medications can cause, and knowing that 80% of people over the age of 65 have at least one chronic disease, and most of those are managed by drugs, either 1 or 15. So the side effects of many of those drugs is dry mouth. So when we think of that, there's a whole range of issues that can cause. We need saliva to swallow, to speak, to smile. We need it to hold your dentures in place. So that lubrication from the saliva helps hold the denture in place, helps hold your partials in place. It helps the food not getting stuck to your teeth. It also can kill bacteria and has antifungal properties. So it can kill bacteria in your mouth, but very importantly, we may not think of it, but having saliva in your mouth and when you swallow, it reduces the amount of bacteria just by getting rid of the bacteria in your mouth by being able to swallow. If you have a really dry mouth, what happens to the bacteria? It sticks to your teeth. What does the bacteria do when it sticks to your teeth? It can cause breakdown on the teeth and the gums and lots of other problems. So it has a lot of very important roles. One of the other roles is it actually will remineralize or will harden your tooth structure, and that can help prevent decay and breakdown. So the last is, and I think really very important, is it aids in the ability to taste. And so if we lack the ability to produce saliva, or if we have negative effects from medications, the ability to really lose this quality of life is quite traumatic. Next slide, please. And just some of the tips that we can do at home to think about, because so many people do have medications. What do we do to get some of that saliva back and minimize those effects? First is just avoid or minimize some of the substances that can irritate and cause problems with your mouth, such as caffeine and fruit juices and alcohol, things like that. We have to give them up. That we have to be conscious if we're going to have them. You may want to rinse more frequently throughout the day, but these will irritate, and if you lack saliva, they'll irritate more. If we go to the right where it's to protect the teeth, we had talked. We can protect the teeth just by doing some very simple things, avoiding sugar or minimizing sugar, because we all have it. But it's important to think about the form and the frequency. So if you drank a cup of soda and it hits your teeth and you swallow it, it'll definitely affect your teeth, but not as much as if you had something like a Tootsie Roll that's stuck to your teeth or some type of really sticky candy, because acid is produced from every exposure to sugar for at least 30 minutes. So with the soda, it's exposed and it's gone. With something that sticks to your teeth, it produces sugar for as long as you have it. Lozenges for dry mouth is what you typically reach for. A lozenge will lubricate your mouth, but the bacteria in your mouth will produce acid, which can cause all those issues for as long as you're sucking on the lozenge. On the replaced some of the saliva, things can help, such as milk and saliva substitutes, and more fluids throughout the day and sips of water and things like that. There's all those things that I think that stimulate saliva you should be aware of, like crushed ice, sugar-free gum, chewing foods like carrots, celery, anything that requires the chewing motion will stimulate saliva. There's also medications that can stimulate saliva, but that's the last reach for us. We stay in this other package of things. Next slide, please. So here's a scenario where you have an uncle or a person that you know that's taking antidepressants, and this is a common question that we get. What mouth problems are frequently a side effect of these drugs, and what behavioral problems are associated with these medications that affect the mouth? So, Rod, do you want to go first on this?
No, go ahead. That's right.
So do you want to start with the medications first? So mouth problems from antidepressants, one of the things that can happen with antidepressants, it dries your mouth up. So going back to what we just talked about, and Dr. Larson talked about, if it dries your mouth out, all of those issues from swallowing and speaking and lubricating and killing bacteria, being able to swallow, increasing the acid in your mouth, all of that increases and it magnifies the problem. So the result can be not being able to talk, swallow well, and the increase in decay is much higher. And so it's really important if you're on antidepressants to be aware of the side effects. And again, if you can't make it to the dentist, it's a really important part to talk to your pharmacist about these drugs, or to any other healthcare providers, for instance, your nurse practitioners, or if you have a home care worker.
Right. I apologize. And those antidepressants are there for a reason. And if it does negatively affect your oral health care and your ability to speak and eat and all these other things, that's going to just magnify the depression that you may have, especially if you can't communicate well and speak with your loved ones or your healthcare providers.
And going back to one of the things that Dr. Larson talked about is ask your prescriber the questions that Dr. Larson had on his slide. What is this going to do? What's the side effects going to be in my mouth or elsewhere? And how can I prevent these? And so that's why those questions are so important. And if those cannot be answered, they can find the answers for you. And the second, what behavioral problems are frequently associated with these medications that affect your mouth? One of the things that we see dentally is if you have a situation where somebody has depression or has issues, the medications sometimes can make you feel more lethargic. It can reduce your motivation potentially to brush. So all of these side effects from the saliva become magnified if you lose that motivation to brush, or the thought that it's going to be helpful for you. So yeah, they go hand in hand, and that's why if there are behavior problems, it's really important for the prescriber to talk to you about it. And if they don't, the pharmacist is absolutely key. Anything else there, Rod? Thank you.
No, I think you're right. It can snowball pretty easily if complications do occur, and keeping an eye on it quickly and seeking that attention is important to make sure it doesn't get worse.
This slide is Aunt Sally has a dry mouth and multiple cavities. She experiences pain and very sensitive teeth. She is not mobile. She lives in long-term care and has very limited finances. And this is not, I would say, this is not an outlier. It's not an unusual example of what we see in long-term care facilities because of the number of medications. And so it's very important to be aware of if you have medications and how does it affect a person in terms of saliva. And in this case, we know that it can cause increased decay and gum problems. How can they be managed? And so everything goes hand in hand. So in long-term care, the other important thing I think that we have realized through the Motivate Project program is that many of the caregivers in facilities around the country, that one of the things they're not trained in is oral health care, on how do you help manage the mouths of patients. Why that is very, very important is that many of the patients that are in long-term care do not have the ability to fully brush their teeth. And so added on top of that, with all the other chronic problems, there's a high percent that also has some type of cognitive issues, and that magnifies the problem. So the dry mouth in a facility where you're relying on others, We have to know the impact of what the medication is doing. And we also have to be sure that the staff knows what to do with this.
And Aunt Sally is at risk for ultimately malnutrition because with the pain and sensitive teeth, oftentimes eating is a problem. And that, of course, magnifies all our other healthcare issues that may occur with Aunt Sally.
We have a question in the chat.
Great.
We have Suzanne who's asked if Dr. Brennan, you've recommended Saliva Max before, and have you seen it work or not?
Saliva substitutes are good. The biggest, as general, saliva substitutes work, and they can give you some relief because it does lubricate. It does substitute for the saliva. One of the downsides that patients will say is that they may not like the feel of the taste, but it can be effective, and I think it can increase the quality of life. One of the things that's important that if you're using a saliva substitute, it does not substitute for good oral hygiene. And I've had patients that rely more on the waters and the rinses than they do on the flossing and the brushing. So it can make a difference. It definitely makes a difference if you have a denture or a partial. It makes a huge difference if you're a patient that's going through chemotherapy or radiation therapy, because it can lubricate those very large ulcers that can result. So it's a great question, but I think saliva substitutes can really play a part, an important part for management. Thank you.
And one of the issues with those is sometimes they're flavored with mint, is often a common flavor, and with someone patients with sensitivities, that can be a problem. They if they're very sensitive or if they're in a lot of pain, sometimes those things can aggravate that. So finding a substitute that doesn't have a harsh flavor or a neutral flavor is important.
Also, just want to remind folks that in the chat, we have dropped in 2 flyers, one oral complications with cancer and another one on dry mouth questions. It's a flyer. So for folks at the atrium, you could click, and maybe print them out. And then there's also a survey in the chat too that we'd very much like to have you fill out. Wonderful. And we have a few minutes. This was really wonderful. Thank you so much, Doctors Larson and Brennan. We're running out of time. If we don't have questions, let's keep going. If you have a question, please put it in the chat and we'd be glad to answer that.
One of the materials that can make a real difference in long-term care is a product called sodium diamine fluoride. And what it is, it's a material that can be placed on the teeth without drills, usually. It reduces dental fear. It's very inexpensive. It's great if you have a lot of cavities, because when you place it on the teeth, it kills bacteria, it stops the decay, it reduces the sensitivity, and it allows you time to actually see a dentist, or if you can't afford to go to the dentist, it can stabilize you. It is the side effect can be darkening of the tooth, which is on the upper right-hand side. But I have to say that most patients that we have placed it on, when the pain is decreased and the teeth are not getting worse, this has been a really management tool for patients. So one of the things that if you have patients in long-term care or family members, think of sodium diamine fluoride as a possibility for quality of life issues. And I think it's a very important piece in a dental toolbox or in a healthcare toolbox, because it can make a big difference.
Well, it looks like we're at time. We certainly appreciate everyone attending today's session. And again, we have some helpful documents in the chat box, as well as a survey and also a link to our Oral Health Wisdom website where you can look for more information and resources about our program. So thank you so much today.
Thanks, everyone, and please join us next week.